Hey there, Naveen Nathan here with the third installment of our Regional Orthopedic Anesthesia series for the ABA Advanced exam. We've covered most of the upper extremity, but we still have to talk a little bit about peripheral upper extremity nerve blocks, so individual nerve blocks in the forearm and hand. So we're going to start with the musculocutaneous nerve block. Okay, is the musculocutaneous nerve blocked either medial or lateral to the biceps tendon? Okay. So we're going to have a series of images from Miller's Anesthesia that help guide you in terms of how you do peripheral upper extremity blocks. I don't know if they're going to ask too many questions related to the peripheral terminal nerve blocks, but I wanted to make this complete. So overall, if the musculocutaneous nerve is not blocked by the axillary approach, it can be blocked, as I said in the previous lecture, by injecting within the body of the coracobrachialis or at the elbow superficially at the lateral aspect of the antecubital fossa, just above the inner epicondylar line. Okay. And you do this immediately lateral to the biceps tendon, lateral to the biceps tendon. So remember, musculocutaneous is all lateral. It innervates sensation to the lateral upper forearm, okay? Overall, it's a pretty straightforward block to do, and it should be thought of as a rescue technique in the event that an axillary nerve block is performed and you don't capture the musculocutaneous nerve in the process. Now, with the median nerve block, this is performed to provide anesthesia of the palmar aspects of the thumb, the index finger, the middle finger, and the radial half of the ring finger. Okay, the ulnar nerve makes up the other 1.5 of the digits. Okay, motor block includes muscles of the thenar eminence and the lumbrical muscles of the first and second digits. In the case of the block at the elbow, you can block this at the elbow or more distally. The median nerve innervated wrist flexor muscles of the forearm will also be captured. So is the median nerve blocked medial or lateral to the brachial artery? Okay, well, so when the patient's arm is placed in the anatomic position with the palm up, a line is drawn connecting the medial and lateral epicondyles of the humerus. That's your epicondylar line. The major landmark for this technique of median nerve blockade is the brachial artery, okay? And that is found medial to the biceps tendon at the intercarnular line, okay? So the artery is medial to the biceps tendon. And then the median nerve lies medial to that artery, okay? So from lateral to medial, it goes biceps tendon, artery, and then median nerve. So you can block it with a small volume of local anesthetic medial to that pulse. Okay, so here's what you have at the left anterior elbow. So this is lateral over here. This is medial over here. As you can see, you can have the patient flex their forearm, flex their arm, I should say, and you can identify the biceps tendon. Just medial to that is the artery. Just medial to that is the median nerve. So you can do this with ultrasound guidance as well. You just have to have an image that shows you what's lateral or medial in case this shows up on the exam. And again, you're always medial to the artery. Okay. So the median nerve is located between the flexor carpi radialis and palmaris longus tendons. So you can do this block at the level of the wrist. Okay, and this can be done even by a surgeon for example, superficial surgery on the hand. And you can block about 2 to 3 centimeters proximal to the wrist crease. You can feel loss resistance as the needle passes through the flexor retinaculum with 2 to 4 cc's of solution that can be injected. Of course, if you're doing this for example, carpal tunnel syndrome, remember that's a very tight retinaculum, and they have pain as a result of that. That's why they're having surgery. So this may not be the best approach for something like that. And this is exactly what we're showing you in a picture from Miller's Anesthesia. There's the flexor carpi radialis tendon, and here is the palmaris longus tendon, and there's the median nerve living right in between. Ulnar nerve block. So this might be done if you miss the ulnar nerve with an inner scalene. Okay, the ulnar nerve provides anesthesia to the ulnar side of the hand, so the medial side of the little finger and half of the ring finger. The small muscles of the hand except those of the thenar eminence and the first and second lumbrical muscles, which are governed by the median nerve. So, although the ulnar nerve is easily accessible at its subcutaneous position posterior to the medial epicondyle, remember, when you have patients under general anesthesia, if the patient's upper extremities are pronated on their arm boards, you can trap the ulnar nerve in the intercondylar groove and cause ulnar neuropathy because it's so accessible at that level. And that's actually the very reason why you don't want to block it at that level. Although that technique has been described, it's such a tight, non-compliant space that you can cause nerve injury there. That being said, the nerve can be blocked distally at a site about 5 centimeters proximal to the elbow. And that way it's not trapped within a non-compliant space in that intercondylar groove. So where is the ulnar nerve blocked at the wrist level? Is it medial or lateral to the ulnar artery? We'll in a second go back to that previous picture, show you, but you can do these nerve blocks all the way distally down at the level of the wrist. Okay, the ulnar nerve lies between the flexor carpi ulnaris tendon, between the ulnar artery and the pisiform bone. At this point, it's already given off its palmar cutaneous and dorsal branches, so you may not capture all of the branches of the ulnar nerve at this point. Okay, and this image is what we're talking about here. So you see the ulnar artery right there and the ulnar nerve, which is just medial to that. If your arm is in anatomic position, it's going to be medial to that. And again, you have an ultrasound image. I'd be surprised if they gave you an ultrasound image of distal terminal nerves, but for the sake of completion, I did include this from Barish's Anesthesia. And you can see the ulnar nerve right here, which is medial, as I said, to the ulnar artery. Lastly, radial nerve block. Okay, blockade of the radial nerve provides anesthesia to the lateral aspect of the dorsum of the hand. Most of the dorsum is governed by the radial nerve, and the proximal portion of the thumb, index, middle, and lateral half of the ring finger. So that's what this shows here. So the radial nerve is pretty much going to anesthetize and govern sensation to the dorsum of the hand in this distribution. The ulnar nerve kind of wraps around the other 1.5 digits over here on the dorsum and on the volar aspect of the hand. So the radial nerve can be blocked at the level of the elbow as it passes over the anterior aspect of the lateral epicondyle at a point 2 centimeters lateral to the biceps tendon. So whereas you can block the median nerve medial to the biceps tendon and medial to the artery, you can block the radial nerve lateral to the biceps tendon. You can block it at the level of the wrist, much like the other terminal nerves, in a series of essentially a field block to capture all the peripheral branches of the radial nerve. The extensor pollicis longus tendon is identified when the patient extends the thumb. Okay, that makes it readily apparent where that is. And the needle insertion site is over this tendon at the base of the first metacarpal. Overall, the solution is injected superficial to the tendon, and all you need is 1 to 2 cc's of local anesthetic to accomplish this. And that's essentially what you see here in this image from Miller. You're just essentially doing a field block on the lateral aspect at the base of the thumb. So that pretty much covers all of the upper extremity from shoulder all the way down to the fingertips. And we're going to move on to the lower extremity in the forthcoming lectures of this series. Thanks.